The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
So, first, let's just talk about an erection and kind of what the process is and how it happens. So, the erection, it's a complicated process, but ultimately it's a vascular process. So you need blood flow into the penis, you need those vessels to expand and kind of trap that blood in there. So you get arousal, the nerves are activated. What's going to happen is those arteries are going to start to dilate and blood's going to flow into the erectile body. So there's kind of three chambers in the penis, and there's two paired chambers, the corpora cavernosa, which are the erectile bodies, and there's the tube, corpus spongiosum, the urethra, where you urinate through. And so those kind of make up the penis, and the corpora cavernosa will dilate. You get blood flow in there, and then the next important part of the erection is the veins around it are going to get kind of occluded and blocked, and that'll allow the penis to get rigid and firm and give you the rigidity you're looking for penetration. And so you need both of those processes, blood flow in there, and you need that blood to get trapped in there to get a good erection. So oftentimes, there's issues with those. It could be from things like, high blood pressure, cholesterol, diabetes. It could be surgeries you had where you're not getting the blood flow in there, and it's not getting trapped. And it's going to present as erectile dysfunction, where it doesn't last as long as you want. It's not as firm as you want. You're not able to have penetrative intercourse. And then so you start seeking, help, seeking providers. Usually you'll start with some pills, Viagra, Cialis, but for a lot of guys that doesn't work. And then there are options beyond the pills. And one that we're going to kind of focus on tonight is the intracavernosal injection, or ICI. And that's that intracavernosal, so injecting it directly into the erectile body. So what is it that we're injecting there? So, the goal is to dilate the blood vessels. So it's the same thing the pills do. So the what we call the PDE5 inhibitors, what it's going to cause is vasodilation. But with the pills, that medication's in your whole system. And so you're going to get some of the systemic side effects. So you get the headache, the flushing. It's the same thing. Blood is flushing to your brain just like it is to your penis. This medication is delivered directly to the penis. So it acts a little stronger in that area, and you don't get a lot of the systemic or side effects that you get throughout the body. So what are these medications? So it's a combination of different agents that cause vasodilation. So and depending upon the formulation that you're taking, there can be a combination of them individually. So alprostadil, which is a prostaglandin, causes vasodilation, and the papaverine and the phentolamine are also other medications that will cause vasodilation. So expansion of blood flow to allow more blood to rush into the penis. And so oftentimes you'll be prescribed what's called Trimix. And so what that is the combination of the alprostadil, the papaverine, and the phentolamine. And then Bimix is just a combination of the papaverine and the phentolamine. And there may be some benefits, which we can talk about a little bit later. We're excluding the prostaglandin, they're alprostadil. But ultimately, the goal is to get enough blood into the penis and allow enough expansion to kind of trap that blood in there. So MenMD offers a variety of combinations. And so what it is, it's kind of playing with different numbers here, different strengths of each medication to achieve the desired effect, which is to get a firm erection that will last long enough for intercourse. And so we don't want to give you too much because there is risk of having an erection that lasts too long. And we don't want you having this inject your penis multiple times to get that right combination. So they offer a variety of medications. So like I said, the Bimix is just the papaverine and the phentolamine. It's kind of, you start with the weakest dose and kind of work your way up. One of the benefits of the Bimix is it doesn't have that alprostadil like I talked about, because the alprostadil can sometimes cause kind of this aching or kind of painful sensation. So, there's, a slight pain from the actual sticking the needle in the penis, but the medication itself can cause a little bit of discomfort. So if that's something that you're experiencing, Bimix may be a good option. But oftentimes we need the Trimix to give you the strong enough erection. And there's a variety of options. And usually in my practice, or a lot of, we start at the lowest dose and then we'll kind of work your way up. And it's kind of a guessing game to kind of figure out what exactly is the best formulation for each patient. So what will come with the medication? So a needle and syringe, and we'll kind of go over this, but there's really, these are all, either 50 or 100 cc syringes, so very small syringes, small needles. And usually the medication will be prescribed in units. So if you're prescribed 30 units, what is that? It's 0.3 cc's or 0.3 ml, so a very small amount of medication. These needles come in different sizes, different what we call gauge or thickness of the needles and lengths of the needles, because ideally, we want you to be able to not only inject past the skin, but get right into the corporal body. So there are some various options given your anatomy. Within the syringe, when you pull it back, you pull back that little plunger there, that will get the medication, and you can line that up to what your dose is. So if you're prescribed 20 units, you pull it back to 20 here, which is 0.2 cc's. So how do you figure out kind of what is your dose? So oftentimes your first injection will be done in the office, either, just with the injection, or sometimes what's called a penile Doppler, where they'll use an ultrasound probe and kind of look at the blood vessels and see how it responds. And based upon that, then you'll be prescribed the medication and the proper dose. And like we talked about, sometimes it takes a little adjusting, but the goal is to get an erection that will last long enough, but it will also come down in a reasonable time. We don't want an erection to last too long that requires either a reversal agent or any other medication to bring that down, or a prolonged erection, you call it priapism, where the erection lasts longer than 4 hours, and that can be an emergency. So that's why it's always better to start low and kind of work your way up to that desired erection. But you want it to be rigid enough. You want to be able to have penetrative intercourse, and you want this to work well. If you're going through the trouble of getting the medication, getting it out of the fridge, and injecting it, you want it to work. So it's always important you don't exceed the dose that is recommended to you by your urologist. And you don't want to do this more than once in one 24-hour period. And about 3 to 4 times a week is kind of the maximum. The more you're injecting, it can cause some issues with some scar tissue and things like that. So it's always best to kind of maintain those parameters. But then over here, the goal is to kind of get this erection between 6 and 10, where you're able to still have, penetrative intercourse and have success, but also not get it lasting too long. So how are you going to prepare the injection? So first you're going to have your supplies, so the syringe, the vial, and then some alcohol swabs, and we'll show you how you kind of prepare all that. So your medication is going to come in a vial. You will keep this in the refrigerator. And when you first get it, there's going to be a little cap over the syringe as well as the vial here. But you want to remove that cap. And then you're going to pull back the plunger to your desired dose. So if you're 20 units, you pull it back to 0.2. The syringe will go into the vial. You're going to inject that amount of air and then turn it over and pull back to that desired amount. You'll then remove the syringe and kind of tap it and get any air bubbles out. And I'll do this all in a demonstration as well, but we'll talk about it. So then, how do you inject this into your penis? So first you want to clean the area of the penis with an alcohol swab. And then, on the penis, like we talked about, there's kind of those 3 chambers there, and you want to deliver this directly into the erectile body. So then the corpora cavernosa. So kind of 2 and 10 o'clock is what I tell my patients. On the top of the penis, that's where the nerves and the blood vessels are, and on the bottom is the urethra, the tube you pee from. So you want to avoid those areas. And you also, along the skin, you want to avoid any kind of superficial or any veins you can see directly on the skin. But you want to inject the syringe kind of perpendicular, so so you can deliver the needle all the way in, and deliver it all the way to the hub there. Some guys will just kind of put the needle in just a little bit, but you kind of have to feel that second pop to get that directly into the erectile tissue. You then slowly deliver your medication and then apply a little pressure, use your alcohol swab to stop any bleeding there. So, I mean, the key is really proper technique, proper dosage. You want to make sure, like you said, avoid certain areas of the penis, that you're sticking the needle in all the way. That's why I think it's important to have that first injection in the office. But it's always, you feel like you did it in the office, yeah, it's no big deal, and you go home and then you're all, you're worried about it, you're stressed about it. So there's great resources through MenMD, but also just being comfortable with your physician that you fully understand what you're expected to do and how to do it properly. You can alternate sites within the penis. You can start on the right side. There are connections between the right and left erectile body, so you don't have to inject on both sides each time. The medication will kind of spread its way through, but you can alternate. You can, go more at the base of the penis, a little farther out. Some guys will say they have one area where it doesn't work as well, but it's good to alternate sites. And like we talked about, really try not to inject more than once in a 24-hour period. It is important that the vials are stored in the refrigerator, and they are safe up to 28 days after that first puncture. So what are some other things that are provided by MenMD to make this process easier? So there's travel cases, because if you're traveling, you got a lot of different things, the vials, the syringes, something to kind of keep it all organized can be really nice. There's things where you can kind of have the medication pre-drawn and kind of stored that way. The auto injector can be nice for guys that have trouble sticking the needle in all the way and delivering the medication. It's kind of like an EpiPen where you can just apply that to where you want to inject, and you press a button and it'll deliver the needle and the plunger. And then it's also important to have a sharps container where you don't have needles lying around or anything like that. So these are all things that are offered through MenMD.
Alrighty, and I'll cover this one real quick as far as how MenMD can help. And get more information from a MenMD personal health assistant. They'll provide you answers and insights to your questions about treatment effectiveness, dosing, and administration. That is the link right there, menmd.com/portal, and then you want to click on the support tab, or you can always call at 857-233-5837 and request a personal health assistant.
So let's just say you were prescribed 20 units. So you have your syringe, and you're going to pull that back. So that's 0.2 cc's or 20 units. You take your vial, stick that needle in all the way, pull the plunger, and then pull it up. You're going to come back to your 20 units. Get any air bubbles. So then we have our friend here, the famous Mr. Limpy. So like we talked about, nerves, blood vessels are on the top here, and the urethra is on the bottom. So we want to inject right on the sides here, 2, 10 o'clock. And like I said, kind of perpendicular. So you want to come in like this. You don't want to have it angled in any direction. You want to come in perpendicular because you want to be able to, nice steady movement, and inject that all the way in to the corporal body. So if you're off to the side here, you can kind of just get under the skin, and then it'll kind of create a bleb, and it's just not going to work as well. So perpendicular, 2 and 10 o'clock, slowly inject. Then you deliver the plunger, nice and slow. You're going to remove that and apply some pressure. And also it's important, with the alcohol swab to clean this area before you inject. And that's really it. It's simple. Disposing of the needle properly, properly cleaning it. But really, once you do it, most guys there's a lot of fear associated with it. But once they have done it once, they realize it really is kind of like a little bee sting. It's not very painful, and it's rather easy to do.
First question is, how effective is injection therapy for people with type 2 diabetes?
I mean, it's effective in, all forms of ED. If it's diabetics, if it's people who have had prostate cancer, with diabetes, you get vascular disease, and it affects the ability of the blood vessels to dilate in certain areas that they're kind of, they're hardened. So depending on the severity of your disease, but it doesn't preclude you from trying injection therapy. So I think it certainly is worth a shot in diabetics.
Certainly. Alrighty. Moving right along, I saw this multiple times. A lot of people asking about venous leakage. So this person well, first of all, can you talk about venous leakage and how someone can control it? That's their first question.
Yeah, I mean, so like we talked about, the two processes to get a good erection, you need blood flow in there, and you need those vessels to expand and trap that blood in there. And when they don't expand and trap that blood in there, it's a process called venous leak. It can be difficult to manage. There's really no thing you can do to correct it. It's kind of a global process where those blood vessels just don't expand. So, you can, with injections, you can try to get more and more blood flow into the penis, see if you can overcome that. There are some constriction rings out there, things like that, but that really just kind of only affects the part of the penis that's outside the body, where a lot of your erectile tissue is in the inside, and that's really where a lot of the rigidity comes from. And so guys who have bad venous leak fail pills, they fail injections, and that's really where the penile prosthesis is utilized.
Certainly. So there's a little follow-up to that. This person wants to know why the effects of injection therapy seem to work better if they stand during intercourse.
Yeah, so it's the same type of thing. So sometimes positionally, if you're lying flat on your back, that venous leak will be worsened. Where if you're standing, things like that, just the physics and gravity, things like that, where it's not as effective, where the erection will last a little bit longer, and that's just part of that disease process.
Certainly. Alrighty, moving right along. Next question: how often can I inject the medicine if it doesn't work the first time?
Yeah, so I mean, ideally, you don't want to be sticking your needle, the penis, multiple times each time, but you can, inject, wait 5, 10, 20 minutes. If you're not getting it, you can apply an additional dose. I'd say probably, 2 to 3 times is probably enough. And if not, maybe the next time just, do a larger volume, or, reach back out to your provider, MedMD, and see if there's any changes in the formulation that you could use.
Certainly. Next question. I'm interested in trying Trimix. Will it make my ED worse if I try it for a while and decide it's not for me?
No, you're not going to become like dependent upon it or addicted to it, where like it's the only way you can get erections. There are risks, but if you don't need it, I wouldn't say it's going to make, recreationally, it's going to make your erections any better, but it shouldn't really have any long-term effects where your normal process is no longer going to work.
Alrighty. Next question. Ever since I started injecting testosterone, my testicles don't hang at all. Why is this?
So this is a little change in pace here, but yeah. So I mean, your testicles do two things: they produce testosterone and they produce sperm. The most of the bulk of the testicle is from sperm production. So if you're taking exogenous, or you're taking testosterone that you're getting outside the body, your brain gets the feedback, says, hey, we're good on testosterone. So it sends signals to the testicles to kind of slow down their own production. So testosterone production as well as sperm production. And so when they're not getting those signals to continue that, they will atrophy and they will shrink. And so that certainly is a side effect of testosterone therapy.
Alrighty. Next question here. How would you recommend I overcome my hesitation to inject a needle into my penis?
Yeah, I mean, so I think it's just doing it and seeing it and realizing that it's not that painful. I think some of those things that MenMD offer, like the auto injector, can be really helpful, where you can just kind of apply the auto injector along the side of the penis and then just press a button, where you don't have to do the act of inserting the needle and compressing the plunger. If you have a partner that's willing and open to it, I think that can be helpful as well. But for I have some guys who just say there's no way we're sticking a needle in my penis, and I think that's when you start having a discussion about what are some other options out there. But I think it's worth a shot, and there are options to kind of help it make it easier.
Certainly. Alrighty. Next question here. This person says, last week when I injected, I felt like I hit something. Then the next day, it was black and blue. What could it have been?
So it could have been one of those superficial veins along the side of the penis. Certainly, if you kind of pass a needle through that, it can cause some bruising and some bleeding there. Sometimes the what we call the tunica albuginea, the kind of the tissue around the erectile bodies, can get plaques in it and can be firm. It can be somewhat difficult to pass the syringe through that. But most likely, if you had a little bruise afterwards, you hit one of those superficial veins.
Alrighty. Next question is a bit alarming, but this person asked, what causes an erection to last 6 to 8 hours after an injection?
Yeah, I mean, so this medication, it's strong stuff, and it's just going to cause, if you're at such a high dose, or you're medication can kind of stick around, and it causes that the tissues to vasodilate, and they can get persistent dilation where it traps that blood in there, and it can just continue because there's not getting new blood in there, and certainly 4 hours is when it becomes a medical emergency. I mean, if you're not getting new blood into the penis, the tissues there aren't getting oxygen, which they need to survive. And so you certainly need to seek help to get that erection down, either with injection or some other options. But it's just this medication is strong, and it can cause an erection that lasts that long.
Certainly. Next question here. I experience different levels of erections when injecting the same quantity of Trimix. Is there a way I can avoid this?
Yeah, I mean, there's no like 20 units can give you this much of an erection, 30 units is give you this much. And so that's why it's always best to kind of start a low dose. And there can be other factors that play a role in it. And, there's no exact science to this. So it can be frustrating at times where you say, hey, this is the dose I've been using, and all of a sudden it doesn't work. Or why this time did I get the erection that lasts, 6 hours? And so there isn't a great answer to that, but it's just something that comes with this type of treatment modality.
Alrighty. So I know you already covered how often you should inject, about 4 times a week. Someone asked, though, kind of as a follow-up to that, how many years is this therapy usually effective?
So, I mean, it can be effective for a long time. I think dropout rates are pretty high, though. I think patients get frustrated with the whole process of it, of having to go to the refrigerator, having to inject the needle, wondering if it's going to work. You still have kind of that guessing game. So, I mean, I think patients can be on it for years. I would say the average patient is probably, less than a year, 6 months or so, but there's no time limit where you say, all right, we're not doing it. It just kind of depends on how you tolerate it, how it's working, and if it's something you want to continue doing.
Certainly. Next question here. What is the best timing for injection prior to intercourse?
So I tell guys, somewhere between 5 and 20 minutes, you can inject, and then, foreplay, other things. You don't have to sit there and wait and say, all that stuff will help as well. It can be part of that process. It doesn't have to go straight to intercourse. So I usually tell guys between 5 and 20 minutes is where you're gonna get that maximum result.
Awesome. So next couple of questions are some adverse reactions to injection therapy, but did not see them come up too many times. This one was, how can you reduce pain, migraine of the groin that occurs with injection therapy?
Yeah, I mean, so sometimes it's related to the type of medication. So sometimes, that Bimix, where you don't have the prostaglandin can be helpful if you kind of have that aching pain. Sometimes if you have any Peyronie's disease or scar tissue or curvature of the penis, sometimes if you get a firm erection, you can have some of that ache. Like I said, a lot of the erectile tissue is inside the body, and that kind of goes down towards the groin. So if that area is expanding, and it can cause some discomfort there. So it's kind of playing with the medications, figuring out what the right dose is for you to kind of minimize the side effects, yet get the desired result.
Alrighty. I know you mentioned that there may be a little bleeding at the injection site. This person's wondering how they can prevent this from happening, if at all.
Yeah, I mean, so I think, first looking on the skin, making sure you're avoiding any superficial veins, delivering the needle perpendicular and kind of one steady motion where you, instead of kind of slowly injecting, you want it to be one firm motion. And then when you remove it, certainly apply some pressure, hold some pressure there for a while, use the alcohol swab to hold some pressure. All those things can help reduce any bruising or bleeding afterwards.
Alrighty. This person is wondering what percentage of people this may not work for. They feel as if they fall into this group.
Yeah, I mean, I think it's depending on the severity. There's certainly a large volume of guys where this isn't the best option or a option at all. What number that is hard to kind of quantify, but I'd say at least 25%, if not more, of guys where this really it doesn't work. But I think it's for a lot of practices, it's kind of an option. I like to present after the pills kind of all the options that are out there, and including this. And it's not right for everyone, and it may not work for everyone. So if you are in that group, there are other options out there, and I think prosthetic urology is probably where to go. And so just making sure you find yourself a urologist who's comfortable in that area and having that discussion.
Certainly. So next question here. Why would injection therapy work for me when Viagra and other products don't?
Yeah, so I think some of the benefits, like we talked about, this is delivered right into the erectile body. So it's stronger than the Viagra and Cialis, and it's delivered right where you want it. So it may, be able to overcome some of those vascular problems that are causing the erectile difficulty in the first place. And so that's why this is kind of an escalation in therapy, is because we're delivering it right there. And this is strong medication that's delivered locally.
Certainly. I believe we briefly covered this in the beginning of the presentation, but just going to bring it up again. How do you determine your dosing?
Yeah, so we'll do a test dose in the office, and it's kind of with the lowest, the Trimix number 5, which is kind of one of the lower doses. And we start low, so we usually start around 10 units, see how the response is in the office. Certainly, response at home is usually a little bit better. They're not looking at me. They're not in the doctor's office. So we usually start guys between 10 to 20 units, and then we'll kind of play with that and see. And I think using that scale that we showed earlier, where you kind of rate your erection in terms of the rigidity, kind of documenting how long it lasts, any adverse effects, can be really helpful as you figure out what the best dose is for you.
Certainly. And as a follow-up to that, how quickly would you say someone builds up a tolerance to this medication, if at all?
I don't think that really a tolerance develops. I think it's more maybe the disease process worsens. So it's not something where you once you start it, you're going to need higher and higher doses. You're going to need more and more and all that. But I think it's more, maybe your diabetes is worsening, or other things like that are causing worsening of the erectile process that causes the medication not to work.
Certainly. Next question here. Will the injection medication take away the ability to have an ejaculation by reducing my sensitivity?
No. So it's really just going to help you with the erectile process. So the ejaculatory process is a different process, and it really shouldn't interfere with any of that. So it's kind of what you had before this. Certainly some guys say, wasn't one, but may have been years before, since they had ejaculated. So what else could potentially be going on? But you'll still be able to, sensation will be the same. You still be able to ejaculate.
Certainly. Next question here. When I do an injection, I can see a visible lump at the ejection site. It is uncomfortable for me and my partner. What may be causing this?
Yeah, so I think maybe one is that you're not sticking the needle in all the way, and you're kind of, when you inject just underneath the skin, it'll cause kind of a little wheel of the medication is left there, or you're hitting kind of a superficial vein, which is causing a little bleeding at that site, which causes a little hematoma. So I would make sure you're sticking the needle in all the way, and the medication is being delivered into the erectile body, and just kind of closely inspecting and make sure you apply some pressure after you do the injection.
Alrighty. Moving right along, we got a handful of Peyronie's questions here. So first question about Peyronie's disease. Do you want to maybe just tell the audience what Peyronie's is first before we hop into it?
Peyronie's disease is just kind of abnormal wound healing of the penis, and so that area, that tunica that surrounds the erectile bodies, can develop some plaque there. And what happens is, normally that tissue just expands and you get nice symmetrical expansion, but if there's some plaque there, it will kind of get tethered, and so that can cause some narrowing, some shortening, some hourglass, or cause some curvature of the penis. Just from that tissue not expanding quite well.
Certainly. All right. So first, Peyronie's disease question. It's a little bit obvious, but can the injections cause Peyronie's? And if so, how can I minimize it?
Yeah, so I mean, anytime you're sticking a needle through that tissue, it can cause some inflammatory process. We don't know why some guys get Peyronie's disease and other guys don't. We think it comes from some trauma to the penis. So there's some people have a penile injury or a penile fracture, but most guys don't recall that. We think it's just kind of micro trauma from intercourse. But certainly you're sticking a needle through there can cause some trauma as well. So I am a little hesitant to do injection therapy in guys who are prone to Peyronie's disease or already have Peyronie's disease. So I think kind of minimizing the amount of injection, so making sure you can get that, you want to get it right on the first time, and delivering the needle swiftly through, so there's not a whole lot of slowly delivering it, where you can cause some shear forces, alternating sites, things like that can be helpful.
Certainly. So next couple of questions, I guess, are about reversal of Peyronie's. So this person says at their last doc visit, they noticed some scar tissue. Is this something that could be massaged out?
No, unfortunately, no. I mean, there's a lot of options for Peyronie's disease. There's no great option like massage. I wish. But there are treatment options to kind of affect. So just because you have a plaque there or you have some curvature doesn't mean you have to do anything. But if it's affecting your ability to have intercourse, if you're bothered by it, there are a variety of treatment options out there. There's therapy where you can inject a different type of medication and you inject it into the plaque and not into the erectile tissue. And then there are some surgical options. But there's no oral, no pills. There's no topical agents that have really been proven to be effective. There are some devices, some traction devices, things like that may play a role.
All right. Last Peyronie's disease question is discussing the P-shot and benefits as well.
Yeah, I mean, so really the P-shot, which is a platelet-rich plasma, so stuff like that, stem cell injections, shockwave therapy. A lot of these things are very experimental. Places offer them. They charge you cash, things like that. But we're still trying to figure out which ones are best and how to do it, and the science behind it is still lagging. So I would, I can't really recommend for it. I think you got to be cautious with those things. and really kind of do your research. Is this the type of thing you wanted to spend your money on? But you got to be careful with those.
Certainly do. Alrighty, moving right along. Our next category here is injection technique and storage questions. So, first question here is, my penis shaft is short due to pubic fat pad plus belly fat. Is there anything I can do to make injections easier?
Yeah, so I mean that can be tricky. Holding the head of the penis and really stretching it is helpful. And you may need someone else to help you, but kind of holding that fat pad back and pinching it. You could do that, or your partner, and then injecting that way. But really getting a good grip on the head of the penis and really pulling and holding that fat pad back would probably be the best way to go about it.
Alrighty, next question. I tried injections and cannot get it in the right place in the penis. I guess a little bit similar, but my belly's in the way. Any suggestions? I'm 73.
Yeah, it's the same type of thing. I mean, you may need some help. You may need an extra set of hands. Sometimes maybe if you're lying down, it may be a little easier versus standing up. Sometimes that helps that belly fat kind of go away. Using the mirror, things like that may be helpful.
Alrighty. Got a storage question here. So I know we discussed the 28-day shelf life of Trimix. What happens if it's used after the expiration date?
I don't know. I don't know what MNMD would say, but I mean you're probably going to be okay. But just the strength just may kind of wear off a little bit. And so I think the safest thing to do would just refill it and get a new one. But if you are using it, it probably is going to be okay, but it may not work as well. I don't think you're probably going to get significant, downside or side effects, but there is always risks of contamination, things like that, if things have been sitting long in the fridge for that long.
Certainly. So follow up on that. How long will an unopened vial of injection medication be good for? Is that also typically the same 28-day rule?
No, I think that will be longer. I don't know the exact, but I think it can last you, a couple months. It's when you open it, it really kind of sets that clock there.
For sure. Alrighty, so this one's not necessarily a technique question, but it slipped in here. This one is, what damage can be caused by injecting the medication too quickly?
I mean, it's more, sometimes some discomfort. Sometimes you'll inject some before you get all the way into the erectile body. But if you are injecting large volumes, if you're getting up to, 50, 70 units, it's a little larger volume. It's probably not going to cause any damage, maybe a little more uncomfortable, but also just may not get, delivered in the right spot.
Alrighty. So we discussed picking a proper dose in the office. Is this, do you guys also cover like proper size needle picking too? Sorry, that's a bad way to word it, but.
Yeah, I mean, I think, most of these standard needles will work for most guys. They're thin, the length is usually adequate. Usually there's not a whole lot of fat or other things around kind of the penis where we're injecting there. So it's usually pretty standard. But if it's something, we prescribe it and it's just not working for the patient for some reason, we kind of make some adjustments.
Certainly. Another technique question here. What is the best way to inject an uncircumcised penis?
Same thing. I think it's important you still kind of pull back the foreskin just so you can have the penis stretched. So really, this one is circumcised, but pulling that back and extending it just so you can really see well. And it's on stretch. There's not a whole lot of tissue between the skin and the erectile body. So same thing, pull back the foreskin, penis on stretch, would be the same technique.
Alrighty. This person wants to know, with quotations around this, how long can I warm up the medication? I think they mean by taking it out of the refrigerator before injection.
Yeah, I mean, you don't want it out there for too long. But if you want to have the syringe ready where you're not running to the fridge, so 30 minutes is probably fine.
Alrighty. This person says they are right-handed. They want to know what is the proper technique for injecting on the left side of the penis, which is inherently awkward.
Yeah, so if you're kind of holding it out, I mean, you can certainly inject with your offhand, but if you really want it to stay with that, I mean, you can hold the penis off to the side. So if you're left-handed, you kind of point it to your right side, and then I would just kind of come over the top and inject that way. It's a little awkward here on the camera, but I still think you can kind of with your offhand hold the penis on stretch and just kind of bend it. To the right and then expose that area there that you can inject safely and you can see all that.
Awesome. This person wants to know if there's any special technique for getting the needle into the bottle. They seem to keep bending it when they're trying to do so.
Yeah, I mean, I think it's just making sure you're kind of staying right in the middle. There's kind of a bullseye there. So right in the middle. And I think, if you have the vial on the table, sometimes it's hard when you're kind of trying to do it up in the air and all that. So vial on the table and right in the middle and just stick that plunger down all the way and steady will usually get you in the right spot.
Alrighty. So we got a couple more questions coming up here. These ones are going to be about injection therapy with other modalities. So the first question is, how much Viagra and Trimix can you take during intercourse?
So Viagra and Trimix?
Yeah.
I mean, ideally, you're not mixing them. It does set you up for that higher risk of priapism or prolonged erection. But certainly guys do it. If it's something I would just kind of caution, if you're taking the Viagra, do you really feel like you need the injection? And if you do, you need injection, do you really feel like you need the Viagra as well? But if you're taking both, I would just start low with the injection therapy. There's no, you're kind of off script there. So I would just start low and see, but there's really, it's not really recommended. So there's really no max dose that you can do.
Alrighty. Next question here. What is this? Is there a time interval between using a PDE5 and an injection medication?
Well, so it depends on what so the Viagra, those are usually out of the system between, 8, 12 hours or so. They're not lasting much longer than a day. Where the Cialis or the Tadalafil stays in the system for a couple of days. So depending on which one you're taking, may or may not have any interaction. And so it's just, like we said, it's just trying to be cautious about this and not set yourself up for any risk of that priapism. So it just kind of depends on which one you're taking and how long, but knowing your medication, how long they stay in the system is important.
Certainly. Alrighty. Next question here. Can therapies such as injection therapy and vacuum and the VED be combined?
Yeah. So, the vacuum erection device is kind of a negative pressure device, draws blood into the penis, and then can be used in combination with like a constriction ring. You could do both there. You're not going to really cause any harm in combining them.
Sure. So next couple questions aren't about injection therapy and other modalities. They're about injection therapy with other medical conditions. So first question, I had 3 stents and my prostate was removed. Should I and can I consider injection therapy?
Yeah, so there's not a whole lot of contraindications to injection therapy. So, you can be on blood thinners, so aspirin, Coumadin, things like that, and you can still do it. You have to be a little cautious and make sure you apply the pressure. You want to make sure your heart is fit enough for intercourse and kind of the exertion with that, but doesn't preclude you from injection therapy. There's kind of one random contraindication. There's some of these medications that MAOI inhibitors. And there's really no contraindication with the injection therapy, but there can be with the reversal agent, the phenylephrine that we use to bring down it. But those medications aren't really out there all that often. But if you are on one of those, you would know. And it is recommended that you don't do injection therapy. But most other, normal conditions, there's really no contraindication to it.
Alrighty. Following right along, recent prostatectomy. In the 6 times I've recently used Trimix, I've had a 6-hour priapism each time. How can I tell if I've done damage to my penis?
Well, I mean, there is a risk of erectile dysfunction, some curvature, things like that. So this is kind of, you have to wait and see. And if, certainly along with the prostatectomy may cause some issues, but, I have guys who, they're doing injections, but they continue to get the priapism, and it can be dangerous and frustrating. And then maybe talking about maybe some other options, or maybe different doses, some lower dosing.
Certainly. Alrighty, that brings us to the end of our organized questions there. And now we're just gonna hop around, and there won't be in any specific order is what I'm saying. So next question here, this person says they have neuropathy, and they were wondering if the injections will work with this problem. They're on the Tri-3.
What's that?
They said they're currently on Trimix number 3, I believe, and they said it's not working.
Yeah, neuropathy, so, you have nerve damage. So nerves, play a role in the erectile process, things like that. And so if the disease process is pretty bad, even with the medications, you may not be able to get enough blood into the penis, or they're just not expanding enough and not trapping that blood in there. So you may still have that venous leak. And so for some people with really bad disease, it may not be the option for you. You can certainly try to increase the dose, increase change the formulation. But if it's still not working, talking about more advanced therapies.
Alrighty. Next question here. This person wants to know if you have any ideas of how he can use injection therapy with spontaneity.
Yeah, and that's tricky. It's it's not the most spontaneous thing, so that's what frustrates guys. And so I think it's something that you still need to be open with your partner, let them understand kind of why you do this and why it's important. And it doesn't have to be like this big interruption. It just be part of the process of foreplay and things like that. So really trying, I think, to kind of embrace it and not shy away from it, and be open with your partner can make it less stressful and less awkward and bothersome.
Certainly. Saw this one a couple times in the live chat from tonight. What is the best way to travel with ICI medication overseas? So pretty much referring to how to keep it cold enough, long enough.
Yeah, I think there's various things out there for other medications that are TSA approved, where in your carry-on or in your luggage, where you're able to kind of with ice packs and things like that, keep it frozen. But that can be one of the frustrating things with this medication, is kind of how you travel with it. I don't have one specific one that I recommend to patients, but I do think there's some stuff online that allow you to travel safely with your medications that require refrigeration.
Certainly. Alrighty, so brief priapism question here. This person says, sometimes the erection won't go away after ejaculation. It may last another hour. What can I do, if anything, to stop this?
Yeah, so that's just like I said, kind of the nature of the injection. And so trying to adjust the dose, smaller dose, change in formulation. Sometimes ice packs can be helpful. There are some kind of over-the-counter medications that can help it. It's just kind of one of the nature of the injection therapy, that sometimes this happens. But hopefully, luckily the erection's not lasting too long where you're getting into that area of the priapism.
What, if you don't mind just following up on that, what may be some of the over-the-counter medications someone can use to counteract the priapism?
Yeah, so I'm like blanking right now, but like Benadryl can be helpful. And that ice, sometimes ibuprofen, stuff like that can help with some of the discomfort as well.
For sure. I think we've in previous events we've also heard that Sudafed can help too.
Sudafed, yeah.
So
yeah, thank you. I was blanking on that one.
Next question here. Do you have any experience with QuadMix?
So, it's I don't MenMD does not offer it. I actually had recently asked it, but I think when you're kind of getting to that level, it's really more important to start talking about other options that are out there, because it's just a lot of volume, a lot of injection, and clearly there's something going on where that may not be the best option for you.
Yes, and as a slight follow-up to that, MenMD is looking to add QuadMix to our inventory in 2023.
Great.
Alrighty, so another question here. This person says after years of injecting they've noticed tissue and scars. At what point should they consider a penile implant as far as scarring goes?
Yeah, I mean, I think it's always important to know that is an option. I think there's no point where you say, all right, you have to be done with this. But to know that, that there are other options out there for you. And, the injection therapy may not be a long-term option. Certainly doesn't correct anything. So I think whenever you feel like the penile implant is the right thing for you, then it's the time to proceed to that.
Certainly. And just as a follow-up on our travel question for our listeners, we had someone suggest a Yeti cup with ice. Seems like they've had success with that in the past.
I like that.
Yeah. Alrighty. This question here is from the chat. Sorry, one sec. Here we go. Question from the chat. Will an injection cause the semen to turn black?
No. So I mean, it's a different process. I mean, if the needle should avoid the urethra, the tube, or you urinate through, but that's also where you ejaculate through. But certainly, if you get some bleeding in there, and maybe that mixed with the ejaculate may make the ejaculate discolored, but nothing with the injection into the erectile body should cause any discoloration of your ejaculate.
Certainly. Next question here. ICI versus VED for post-prostatectomy rehab. Is one better than the other, or should I consider both?
ICI. What was the other one?
Vacuum erection device.
Oh, vacuum erection. I mean, ICI, you're probably going to get more expansion there. I think the vacuum erection device does play a role. It's not a great erection for intercourse, but it helps maintain some stretch to the penis. And so I think both have a role. Is it going to help you get your erections back sooner? I think the answer is still kind of undefined, or, no one really knows yet, but you can certainly get some erections while you're waiting for your normal process to return. So I think the combination is helpful.
Certainly. Got a question from the chat here. This person says, it seems that I have more difficulty passing urine in the morning after using Trimix. Why? Is it due to strictures, compression? What may be causing?
Interesting. I mean, it really shouldn't. I mean, if you still have some erection there, but maybe just the intercourse ejaculation maybe cause some little inflammation of the urethra, some irritation of the prostate, and then that following morning, maybe it'd be a little harder to urinate. But there are medications out there, things that help with general urinary symptoms. But I don't think it's related directly to the Trimix, but maybe it's just kind of that increased blood flow to that area. It causes a little engorgement of the prostate, which makes it difficult to urinate in the morning.
Certainly. Alrighty, next question here. I've been experiencing delayed ejaculation since starting ICI. Is that related?
Probably not related to the ICI, but maybe related just to not having good erections for a long time. this is something new. Certainly when, I tell guys all the time, when you're thinking about your own penis, it's hard to get a good erection, it's hard to ejaculate. And so, when you're worried about things, you're having any discomfort, it can be hard to kind of be in that moment. And that's important to being able to maintain your erection, to ejaculate. But I don't think it's directly related to the ICI.
Alrighty. And I believe that's going to bring us just about to the end of our show here. So we're going to go ahead and begin to wrap things up.
Those are some great questions. There are more questions than I've ever heard about injection therapy, but that's what's great about this format is, if you have that question, there's probably 10 other guys that are thinking the same thing. So that was really good. I think it kind of covered everything about injection therapy.
If you'd like to learn more about injection therapy, you can contact MenMD at 857-233-5827 or log in on menmd.com.